Infertility is defined as 12 consecutive months of unprotected sex resulting in failure to conceive. In our video, a couple of advanced age is trying to conceive. This couple has been trying for almost 2 years. Our objectives are: the client will verbalize an understanding of his results from his sperm analysis. The client will verbalize their specific cause of infertility, and the client will verbalize the basic steps of an intrauterine insemination procedure.
Come in. Good afternoon, Mr. and Mrs. Smith.
Good afternoon, Dr. T.
As you may recall, at our last consultation, we scheduled Mr. Smith for a semen analysis. Today, we will be reviewing those results and going over any questions or concerns you may have.
Okay.
So the results show that you have a concentration of 8 million sperm per milliliter. We consider anything less than 15 low. Also, the sperm that you do have has a low percentage of good motility. This number is around 30%, and we generally like to see around 40%.
So what does this mean exactly?
Well, this means you don't have enough sperm, and the sperm that you do have are not able to move fast or far enough.
Oh, okay, so my sperm is too slow and there's not enough of them.
I told you it was your fault.
I know.
I told him.
Is there any way to fix them?
So we need to look for structural causes, such as an enlarged vein of your spermatic cord. This could compress areas of the testes, affecting the creation of the sperm. In order to check for this condition, I'm going to send you to a urologist and we will follow up. In the meantime, you need to quit smoking, try eating more vegetables, and add more fish and less processed meats to your diet. These things can naturally improve your sperm count.
Okay, Doc. Thank
That's
you.
what I've been telling him. Thank you, Dr. T.
My assistant will show you the way out and help schedule your next appointment. Y'all have a good day.
You
Thank
too.
you.
Thank you. Come in.
Good afternoon, Mr. and Mrs. Smith. It's
Good
good to see
afternoon,
you
Dr.
again.
T. It's good to see you too.
So last visit, we discussed that Mr. Smith had a low sperm count.
We did.
Yeah.
And we were sending him to the urologist for testing. Well, I spoke to Dr. Smirka about his evaluation, and it sounds like Mr. Smith doesn't have any structural causes for his low sperm count.
Good.
Okay, well, so what do we do now?
While the lifestyle changes we discussed should help improve his sperm count, I would like to talk about intrauterine insemination.
Intrauterine what now?
Intrauterine insemination.
What's that?
What is that?
So intrauterine insemination is where I will collect some semen. I will inject the semen into the vagina as close to the cervix as possible, and this should increase your chances of fertilization. It should give your sperm a head start, so they don't have as far and as long to swim.
So, you're going to take my semen in a syringe and insert it into her vagina and put it as close to her cervix as possible and then inject it. And so they shouldn't have as far to travel?
That is correct. Is that something y'all would be interested in trying?
Absolutely.
Yes.
So we will schedule this procedure around Mrs. Smith's next ovulation.
Okay.
Okay, that sounds awesome.
Do y'all have any further questions?
What are the chances of this actually working, Doc?
Well, it's not exceptionally high. It's around 5 to 15%, and Mrs. Smith's age could make it closer to the lower end of that figure. But don't get discouraged, y'all. There are many other options out there.
Those are some pretty low chances, Doc.
Again, it's not a last resort, and the changes we discussed to improve your sperm increases the chances of success.
Which you said that if I stop smoking and change my diet that it may help?
That will help.
Okay.
Okay. We've been trying for so long. I'm willing to try anything.
Absolutely.
I understand. If y'all think of any further questions, don't hesitate to call the office. In the meantime, I'm gonna have my nurse go ahead and schedule your procedure, okay?
Okay,
Okay,
thank you,
thank you,
doctor.
doctor.
Y'all have a good evening.
You
You too, Dr. T.